Our next speaker this evening is Mr. Andrew Kent, who also works locally as a consultant trauma orthopaedic surgeon at Raigmore Hospital, and he has spent many years working in humanitarian healthcare, including providing trauma training to surgeons in low and middle income countries. He served for 18 years in the Royal Army. In the last 3 years, he has been involved in several missions with the UK Med in Ukraine, Beirut and Eswatini, the Halo Trust in Afghanistan, the World Health Organization in Somalia and Yemen, and the Primary Trauma Care Foundation in Uganda and India. He is also Vice Chair of the Royal College of Surgeons of Edinburgh's Faculty of Remote, Rural and Humanitarian Healthcare in partnership with UK Med and others. Their aim is to provide an academic home for humanitarian healthcare workers from across the spectrum. And he's going to speak to us this evening about his experience of working in Gaza during the current crisis. He spent 4 weeks as a surgeon in Al-Aqsa Hospital in central Gaza through the charity UK Med. Thank you.
Thanks very much. First slide. You can move on. So thanks for that overview and introduction. I'm going to briefly talk about my backstory, more about UK Med and the UK Emergency Medical Team, our response in Gaza, which is ongoing, and my particular involvement. Excellent. As you've heard, these are my own views. They're not representative of UK Med or any other organisation. I wear several hats, as well as being a consultant here at Raigmore, and have gradually given up a few of those hats, and I'm about to retire as a full-time consultant here at the end of this month. Excellent. UK Med is really the UK's frontline response to sudden onset disasters. Historically, that was always natural disasters, but unfortunately, in the last few years, we've been seeing much more in the way of man-made disasters, particularly conflict-related in Ukraine and now in Gaza. I'm not going to dwell too much on the politics of Gaza. My backstory is slightly different, and I have a slightly different perspective, having worked in many countries around the world in conflict situations, both in the UK military and humanitarian. So, after a long wait, UK Med was invited into Gaza, or was permitted into Gaza by the Israeli Defence Forces, the Israeli forces, and we initially sent a recce team into the Nasser Hospital. We were asked to send in a plastics surgeon and a backup staff. They moved into Nasser Hospital early in January, and within 5 days had to be evacuated because the hospital came under direct attack by Israeli forces. They had to be retreated to a safe house and were subsequently evacuated. We received a briefing from the WHO and UK Med in Cairo and passed through the Rafah crossing with a view to establishing a surgical team in Al-Aqsa Hospital, which is in Khan Yunis, in the centre of Gaza. As you can see, the streets were absolutely crowded. Camels, horses and carts, people. It was pretty much impossible to drive anything over than a kilometre an hour. We drove every day to and from Al-Aqsa Hospital from a safe house in near to Rafah, and that drive could take us up to 2 hours, depending on the traffic. We were provided with personal protective equipment, but sitting for 2 hours in a car wearing this was quite awkward, so we just dumped it all in the back of the car until the World Food Kitchen were attacked and several members killed on that very same road that we took every day. So our SOPs changed fairly rapidly. This was our objective. This is the emergency department at the Al-Aqsa Hospital. It's very deceptive. This photograph was taken early in the morning and it's remarkably quiet. I think that's the only time I saw it as quiet as this. So our remit really was to provide a surgical team which comprised myself as an orthopaedic surgeon, Matt, who was our anaesthetist, and 2 theatre nurses, to provide hands-on training and support to the, as you've heard, the overstretched resident medical teams. This is Matt, our anaesthetist, helping with an intubation. Next slide. As I've found in every humanitarian situation I've been in, the local staff, this is the orthopaedic team, were extremely friendly and extremely receptive, and as you've heard, so resilient. Unfortunately, we were unable to bring any of our equipment across the border with us, so we literally went in carrying supplies of water, rations, and our own personal kit. And so we had to operate in fairly austere conditions using often non-sterile and very basic primitive instrumentation. I'm not going to show lots of gory slides, but this is just one of the slides of an aftermath of a major surgery. You can see how basic. These were actually maternity delivery suites that we were using for major surgery. You've heard that the population of Gaza, 50% are under the age of 20. And so there's a disproportionate number of children, some very, very young children, with horrendous injuries caused mainly by blast and shrapnel type injuries, so a lot of limb injuries. Despite that, the healthcare system in Gaza has completely collapsed. And as you've heard from Eco, that patients with chronic medical conditions such as cardiac, renal, mental health conditions and diabetes were receiving no medication and absolutely no care. So concurrently we were seeing lots and lots of amputations for diabetic complications going on in very austere environments. It's not just the surgical problems and the inherent danger of working there. You need to have the non-technical skill set to work. These sort of skills. This is our team in the safe house. Every night we would sit down together and have a debrief, discuss what issues we faced, what lay ahead for the following day. When we arrived in Al-Aqsa, there was already a Jordanian surgical team on site, and it actually was quite difficult to work alongside them or to be accepted by them. But this is us 2 weeks later, having established a rapport, and you can see what a coherent and friendly team we became. It's got nothing to do with Professor Angus Watson arriving out that day and getting into the picture. This is a picture I took on the way to work. This is looking out over the beach into the Mediterranean. Really, coming home can be more difficult than deploying or being on site. And despite the trauma of working particularly with young children, it was with a very heavy heart that I left Gaza after 3 weeks. A lot of people talk about humanitarian healthcare being about giving something back. It's not really. I feel I've always received far more than I've given back by working in a humanitarian setting. I'm going to leave you with this slide. I took this picture of Matt being absolutely scragged by all the kids in the hospital car park. The hospital car park, as you heard, has become like an IDP camp. Okay, there's makeshift tents everywhere, and all these kids are like feral kids. It's like something out of Dickens. And they're so friendly and so happy. 2 weeks after I took this photograph, that very camp was the target of a targeted missile strike apparently on a Hamas operative. And I don't know what happened to these kids. So if any of you are interested in getting involved with UK Med or with humanitarian healthcare in general, please feel free to have a chat with me. This will take you to the Royal College of Surgeons Humanitarian Healthcare course, which is online and free if you're interested. Thank you very much.